Good afternoon, and welcome to another production here on blackdoctor.org. Different pace. We got a different. If you've been watching us all day today, we have been doing some wonderful NMA spotlights for all of the physicians. Not all of them, because we can't get them all here, but some of the physicians that have been here. All of the different. We had enough problems. We had a couple of OBGYNs. We had a brother talking about the criminalization of medicine. It's all been fantastic. So please go back, not right now, go back and go to the blackdoctor.org Facebook page, and you can watch all of those wonderful programs and just learn something about your health. And also, the beautiful thing is some of the stories they shared about their journey, which is what we're here to learn about here with this special smiling face that we have next to us. So they were sharing their journeys, and so we've had the second Black female to graduate from Harvard Medical School here, and she was just fun and talked about her journey as well. So we're here sharing, understanding that doctors are people. They're just not practicing medicine. They are people who happen to practice medicine. And I want you to understand that, which is why we're doing these spotlights to get you that information. So I know you didn't sign on to hear me talk because I got two better looking people next to me. So a couple of things I want you to do for me is let us know where you're watching from. We'd like to know where people are watching us from all over the world. So please drop that in the comment section. Number two, if you know somebody that needs this information, that kind of humanize medicine, please tag them, share it on your page, because we want to get this out to as many people as possible, because there's some great things going on, as well as with Cedars Sinai. We're going to talk about that in a moment as well. So I want to share that information, all that around. I would ask you to ask questions, but I'm not in a role to be able to answer them for you. So please, if you have some questions, please drop those in there, and we will answer them after the show. So that's where we're going to do it. So I have two wonderful people. One of them that has not her first time on video, and that is Mr. Mitchell.
Hello, how are you, my friend?
From Cedars Sinai. We've been having a great time here at the NMA. We are at the National Medical Association Convention in New Orleans, Louisiana. So shout out to folks here in Louisiana. It's been wonderful. It's been jam-packed with great sessions, but a great job. And then we also have Dr. Gabby.
Dellapiana. Dr. D is what I tell my patients to call me. Yes. Gabby is what you can call me.
Look, the Southern tongue is not I know what limitations is. I would keep it. So, Dr. D or Dr. Gabby, as we can call you, we're family now.
Yes,
so,
that's right.
Tell us about it. I've heard you got a remarkable journey through Cedars Sinai system. And so when I heard about this, I was like, we've got to share this with our audience. So tell us about your journey through Cedars Sinai to get you to where you are today.
So I've been at Cedars for 8 years now, because I went there for both residency in obstetrics and gynecology and then my fellowship in maternal fetal medicine. And I'm actually from Salt Lake City, Utah, originally. So it was really important to me to transition to a city with much more diversity and variety of experience. And Los Angeles definitely offers that.
Oh, yes, it does.
Yep. So at Cedars, we work in a lot of different locations, and one of them is a downtown clinic that was California Hospital, which was a partner of ours in the past, where we had so much exposure to the truth of how disparities in healthcare is affecting women's health. Mm-hmm. And because the patient population there was majority Black and Latina, and it really just drove home for me how important it was for me to remain in a community that had a lot of the patients who look like me, because representation matters. Mm-hmm. And I've had so many patients over the years tell me, ask me, can you just be real with me for a second? Black person to Black person, is it safe for me here? Am I going to be okay? Mm-hmm. And to be able to connect on that level has been just so important in my journey. And so I stayed through residency, stayed through fellowship, and now I'm first year faculty.
Well, congratulations for that. And that is an amazing journey. Well, congratulations for getting out of Salt Lake.
Yeah. Yeah, always close.
It's a wonderful city.
It's a beautiful city.
Yeah, that is a fantastic journey. So now you're an OB-GYN, as all of the acronyms say. So Try to kind of help people understand what your day is like as a guy. And are you more an abstract? I can't say that. So are you more on the OB side? Are you more on the guy side? Or are you kind of 50-50 in terms of how you practice?
Yeah, I'm actually subspecialized in maternal fetal medicine, which means that I take care of pregnant women who have high risk pregnancies, and I do ultrasound of the fetus that they're pregnant with, and I deliver babies still. So I still have that obstetrics part built in. So like a typical day for me would be in the ultrasound clinic. And when we're doing ultrasounds, there's three main things that we're looking for. One is the baby normally grown? Because if the baby is too big or too small, either one can be associated with complications. And then number two, we look to see, are there any major birth defects or signs of like a genetic disorder that would impact the kiddo's health after it's born? Right. And then lastly, we evaluate the structures that support the pregnancy, which is the amniotic fluid or the bag water, and the placenta, which is what's giving the baby all of its oxygen and nutrients. And so when I'm not at the ultrasound clinic, then I'm at the hospital. Right. And at the hospital, again, the focus is really on patients who are admitted with complications of pregnancy, which includes a really wide variety of things that can occur. And one of the really important ones that we see all too commonly is preeclampsia, which is high blood pressure of pregnancy that can cause damage to your organs, like to your kidneys or to your liver, to your brain, to your lungs. It can progress to seizures in pregnancy, which can become life-threatening for both mom and for baby. And so
that was
take care of those two aspects.
It's like high blood pressure is unfortunately very, very rampant in communities of color. And so but it can be developed through the pregnancy process, almost like gestational diabetes or something like that?
Exactly. So it's specific to pregnancy, because I have a lot of patients tell me like, I've always had low blood pressure. This isn't going to happen to me. And it's like, no, this is a pregnancy specific problem that gets coded really early on. And so if we're going to be proactive about it, we have to be cognizant of what might your risk factors be. And there are a lot of things that you wouldn't think, like it being your first pregnancy is a risk factor for developing preeclampsia, or being over the age of 35, or being Black, or having other comorbidities like having high blood pressure at baseline or having diabetes at baseline. And so identifying the people who are at risk and getting them on the only prophylactic thing we have, which is baby aspirin, and then making sure that they're really well educated on what the symptoms of preeclampsia are.
So, all right. Y'all see why we have it on the film.
Yeah, right.
Okay. That's fine. That's an aside. So, no, that's fantastic. So, preeclampsia, and you said death. I heard that word, and there's probably a potential complication for both the baby and the mom, or it's just for the mother?
For both, yeah. So for mom, it's the potential risk of organ damage, which could be permanent, of seizures, which is called eclampsia, and that can lead to severe maternal morbidity and mortality, so maternal death. And then with the baby, the issue that's happening with preeclampsia is that the blood vessels that feed the placenta aren't functioning properly. They're not as wide open as they're meant to be to allow all of that oxygen delivery. And so the placenta sends out these little chemicals into mom's bloodstream that cause the high blood pressure in response, but it also is limiting what baby's getting. So baby can be on the small side, which increases the risk of stillbirth. Baby can have the placenta separate away, so it's not getting the oxygen and the blood flow that it needs. So dangerous for both.
And, part of my grade school education, but if you have low oxygen and developing, that can also affect the baby's brain development as well. So you can have some mental defects that are a result of that, not getting enough oxygen.
Absolutely.
Okay. All right. So I learned something. Pay attention. So you're at Cedars Sinai, and we're like, okay, well, why are we talking about Cedars Sinai? So that's why we have the lovely Nicole Mitchell here talking about what are some of the things, why did Cedars decide it was important to be here in New Orleans at the National Medical Association?
Yeah, so at Cedars, we're on this really great journey for diversity, equity, and inclusion, and health equity. It's part of the equity piece of it. So I'm the Chief Diversity and Inclusion Officer there. For us, showing up, we know when we have representation in our physician workforce, our nursing workforce, all of that. To Gabby's point, we have a diverse patient population in Los Angeles, and that comes into Cedars Sinai. We want to make sure that the people taking care of those patients look like them and are representative. So why would we not be here when this is one of the largest places where we can be around Black physicians, right? And the next gen, because we have a lot of great students that are here as well. How can we spread the word that Cedars Sinai is a place for you, right? To come on your education journey in medicine. I think that's a big piece of it. But to come and find a home and do amazing research. We're an academic health center, so we're a teaching hospital. We have 14 residency programs at Cedars Sinai, and growing. We're a growing system. This is a place where you can do research, you can grow your career, you can create new things. And I think we want to make sure we're sharing that message, right? In populations that really reflect our community in Los Angeles. So that's a big piece of why we're here. We have some of our physician recruiters here. I'm here. We have some of our amazing Black physicians here representing too, to answer questions about what's it really like. So I think for us, we want to show up. Right? We want to show people that we're a great place to be. But we also want to be engaged. We don't want it to be performative. I don't want to just say I'm putting my name and logo on something. I want us to be here. We want to be ingrained in it. We have a great partnership with BlackDoctor.org because of the same thing. So that's a little bit about why we're here.
Absolutely. And you're right. You alluded to our partnership with Cedars, and I'm sure you all have seen some of the community conversation programs we've been doing, as well as embracing our community, and really it's been programs targeting those conditions that are disproportionately and how they're impacting the community. And we have specialists that come on from Cedars Sinai to kind of talk about that. So we've done everything from pancreatic cancer to what was the most recent? My mind's going blank. It's just been
Did some men's health stuff. Like we've been in all kinds of things.
Yeah, because this is year 2 of the partnership, and so we've done a number of programs. I think we did 6 last year. And you also provided specialists for our series on dementia and Alzheimer's. Yeah. And so we did a 6-part series on Alzheimer's with Cedars, and that was such great reviews. Dr. Tan is still a fan favorite at BDO because he was so good about really helping our audience understand what Alzheimer's is and how it is a subset of dementia, and really giving us the understanding and how the protein and all of those things work. I was like, oh my gosh, I just said Alzheimer's when you lose your memory. And it's so much more, so much more to that. And Dr. Tan, I thank Dr. Tan for doing that. So at Cedars, so this thing is just did a commercial for Cedars.
Thank you. We appreciate that. Thank you so much.
So pivoting back to you, Gabby, talk about representation matters, and I heard that from Nicole. What does it mean to you when you are working with a patient of color and you say, okay, and they look at you and how do they respond to you when you're the one that's treating them?
Yeah, so as I was saying, I've had so many patients recently who, once we're done with our full consultation, talking about how their baby looks and going through their medical history, are like, okay, now let's have our real talk. And there's been a lot of fear in the newer age about being in the healthcare system. So like fear about delivering in the hospital. So I've had a lot of Black patients tell me they are planning home births. And there is a place for having out of hospital births, such as in birthing centers, but there is a lot of potential risk with that. And so one of the patients who actually really sticks with me is somebody who came to me early and told me, I'm having a home birth, there's no way I'm coming to the hospital. And I counseled her really strongly about preeclampsia, because I was like, all right, well, these are symptoms of preeclampsia that I want you to look out for. And if you have any of these things, you got to come to the hospital. And very early in her pregnancy, 32 weeks, which is like 8 weeks before your due date, months before she was due to deliver, she started having these symptoms, and she came to the hospital, and I think we saved her and her baby's life and gave her the treatment that she needed. And she reached out to me several months later to like send pictures of her baby and to like thank me for having an honest conversation with her and meeting her at her level, because it definitely was not in her birth plan to have had that experience. And it just stems from that fear of being mistreated. And it was nice that she knew she had someone who she could trust to help advocate for her and help take the best care of her possible.
Right. Well, that's fantastic story. I think it goes to show the care that you have, and then the type of caliber of physicians that they have at Cedars Sinai. And just for that patient, I like that story because it talks about a patient taking control of their birthing rights. And like, there's no reason that you have to go to a hospital. But Dr. Gabby did not go and say, no, browbeat her about coming to the hospital. She said, all right, watch for this. And to her credit, she did. And it saved her and her baby's life.
But that's also an example of that race concordant care, right? The matching up, like you have that relationship where one, you can counsel the patient where they can listen, but you can keep it real, and I think that's why that representation piece is so important.
Yeah. I like to say, let's get real. After we got all the medical stuff out the way, let's get real. What's really happening? Because we know the history, but in terms of, there's a big fear in communities of color about weaponization of our medical history, right? And so, because it has happened in the past, we're not, paranoid or making stuff up. It has happened. And so when we're thinking about that, and having a child should be something that's very, very natural, but it is and I've heard different OBGYNs say it's a life-threatening occurrence. It can be. I won't say that. I won't say it is. It can be life-threatening. And so we always have to be cognizant of that. And where it's a wonderful and beautiful thing to experience, but it also is something that can be very detrimental to both the mother and child if all the precautions aren't taken care of. And so thank you, Gabby, for standing in the gap for all those mothers at Cedars. And thank you, Cedars, for being such great partners with us. So, Gabby, what's next for you? Like, what's the next horizon that you want to cross? Cedars, or you want to just keep going on the patient education, because you've got a great base. It could be a base for maternal health.
I am very happy at Cedars and plan to remain there for the foreseeable future. Unless other powers that be have different ideas.
She's on the market now. Update you.
One thing that's really important to me is medical education, and so playing an active role in building the pipeline and recruiting more physicians who are underrepresented medicine to train with us at Cedars Sinai and continue with us, and then most importantly, not just matriculate them, but retain them so they stay and help take care of our population. And it would be great. LA, always thinking about my future modeling career. So if you need a face for a poster, happy to be it.
Well, absolutely. Well, you're welcome back here anytime you want to, because as you know, there is a kind of a maternal mortality crisis in our communities, all jokes aside. And so we're doing whatever we can to get education out about that. And so we need to learn about preeclampsia, right? And understanding. And in that, it could be life-threatening even after the birth of the baby.
Yes. Yeah. Unfortunately, like the cure for preeclampsia right now is delivery, no matter what gestational age you are. So no matter how far along in the pregnancy you are, the only way to treat it is to take out the baby, take out the placenta. But the disease process can linger for as many as weeks, like up to 6 weeks afterwards. And so sometimes we have moms come in after delivery with new high blood pressure, new severe headache, new swelling in their brain that are all consistent with preeclampsia.
Okay. So you have to monitor not just through birth, so you got to monitor before, right? Follow your doctor's instructions, make all your appointments, take your prenatal vitamins, all of the stuff that they tell you to do, and then you have to monitor afterwards. So that after postnatal care really is important as well. And so, Dr. Gabby, somebody, I know you don't do virtual, right? So we can have folks all over this podcast. I need Dr. Gabby.
It's hard to virtually deliver patient babies, but
just give me instructions.
Yeah.
What they do in the movie, give me some hot water,
rip them up.
But seriously, this is a serious matter, but there's no reason why we can't really enjoy while we're trying to do education. And so that's why we're having the jokes, and we're not going to take away from the series of maternal mortality. It is very important to us, for all of our audience and their family members, to make sure that their pregnancy is as healthy and as safe as it can be. And we're happy that we have doctors like Dr. Gabby that are out there standing in the gap for us and giving us that great information. And thank you, Cedars, for coming to recruiting, because understanding we have to see Black faces in these spaces in order for us to feel comfortable. And statistically speaking, we know that Black faces tend to do better when they have a physician of color treating them. And so until we can get to that word, and I'm going to ask you about this before we leave, Nicole, is that before we get to that nirvana of health equity, we've got to, there are some things that we can be doing in the interim, and that is increasing the number of physicians of color so that can treat more patients of color. So we say this fancy term, health equity, right? And it's an industry term. We were talking about this in some of the conversations we've been having here at the conference. And we realize it's more of an industry term than it is a public term.
That's fair.
So help people understand what is health equity. Because we did a survey on Black Doctor, and we said, ask people, do you know what health equity is? And it was a good 30-40% of people said they had no idea what it was. And so that's a significant, reflection of our population. So kind of help people understand what is health equity and why is it important for their health.
And it's interesting that was the feedback too, that percentage, because it is, and it's kind of been a buzzword that we've seen more and more in the last few years, right? So for me, it's how do we level the playing field, right? So the education piece, I think exactly what we're talking about. How do we make sure that people in communities of color are educated about gaps in care or not understanding all of the significance of preeclampsia, like before, after, during, all of that. That is an inequity, right? Like there are communities of color or communities not of color that already know those things.
Right.
So how do we level the playing field? So that's one piece. It's kind of the medical education. How do we get it out there so people can talk about it? But how do we also just decrease barriers across the board, right? So it's access. How do we decrease barriers to access? How do we decrease barriers to education? How do we make sure that the next generation of folks of color who want to get into medicine are exposed to people that look like them, who see our faces places? So if you don't see it, you can't be it, right? Like we all know that piece of it, right? I'm so passionate about that piece because we do a lot with pipeline development because we're hoping that that's going to decrease barriers. So for me, health equity is really just kind of breaking them down, right? Figuring out how we can get the education out there in terms that everybody understands, that they can advocate for themselves, that they feel comfortable working with the healthcare professionals that they're with. So I know it seems like a really big term, but it's really like ultimately leveling the playing field. And think about.
Yeah, I think it's almost like that perspective, right? That it increases the context, right? So if you had, residents doing around when they're all, one ethnic group, they are going to have shared backgrounds, but they're not going to see something that could be something very similar, right? Or they're not going to have that connection to, all right, I live in a community where there might be food deserts, where there might be some lower access to care, there might be barriers to crossing. And so a doctor of color might be like, oh, we got to think about this with regards to, and their treatment plan has to be tailored to that can fit what they can do. And so I think health equity also includes, you see a lot of like urgent care and health systems staying open later and making sure that, hey, if you can't make it during this time, we'll have later hours that are maybe open to 10 p.m. that you can come and get the care that you need. And so it's a mixed bag. It's a lot of stuff in that bag of health equity that we can drop in there. But ultimately, the goal is to, the nirvana goal that I just talked about earlier is really you should be able to see any physician and get that same quality of care. We know the reality from the numbers and from the disparities that that's not true today, but that doesn't mean we don't stop working with our partners to achieve health equity and get one step closer. So that's why Dr. Gabby is out there educating folks on both sides. She's educating folks with Cedars, and she's educating the community. And that's why Cedars is committed to coming here and recruiting more brown and Black faces in their staff, so therefore they can better serve a community that is diverse, that's in LA. So
ask the questions, right? That some people just don't know, right? Yeah.
So again, if you had any questions, please drop those in the comments. We'll answer those questions after the show, but we will get back to you because these shows are all about you and getting the information that you need to make the best decisions for yourself or for a family member. So I want to thank our partners at Cedars Sinai for bringing us Dr. Gabby. She's
Thank you for
fun,
having
too.
me.
Not just Mark, she's fun too. And of course, Nicole Mitchell, you'll see her shining face on here in the future. I'm sure of that. So thank you again for joining us, and we will see y'all next time. We've got some more interviews we got to do today, so we're still doing spotlights of positions here at the NMA, and we're going to be doing some more tomorrow because there's so many different positions. So we're going to be talking to past presidents. We're going to be talking to multiple disciplines here at the NMA, dermatology, psychiatry. We haven't talked to psychiatrists yet. So we got a lot of people that we need to reach, and we're going to get you all the information you need at spotlighting the people behind the position. That's it. We'll see y'all next time.
Thank you.
Thank you.